Thank you for joining us for today's webinar, Rural Health in the 2022 Florida Legislature. For those who are meeting us for the first time, my name is Scott Darius, and I'm the Executive Director at Florida Voices for Health. We're a statewide health advocacy organization, and our mission is to increase access to healthcare for low-income and middle-income Floridians. We do our work primarily through building coalitions and story collection. In our coalitions, we're very fortunate to work with some great partners around the state. They include providers, community-based organizations, advocates, unions, and more. We also collect stories that we share directly with lawmakers and the media in pursuit of policy change. We currently focus on a number of different issues, including Medicaid expansion, access to oral health care, and consumer protections. Now, as you all know, so much of what happens with healthcare in Florida comes down to what happens in Tallahassee. Now, legislative session officially starts in January, but so much has already happened since the start of committee weeks this past fall. Now, today's meeting is really meant to preview some of the healthcare bills that we'll see during session. First, we'll start by setting the stage by sharing some context about where we find ourselves as a state, especially post-COVID. But then we'll go into some of the structural changes that we know that might be different this legislative session. And then we'll spend a bulk of our time looking at some of the different healthcare bills that have been filed to this point. There have already been hundreds filed, so we'll do our best to focus in on some of the key ones. Finally, I'll say that we are thrilled to be able to participate in this meeting with our partners at the Rural Health Partnership of North and Central Florida. We really appreciate the chance to work together to lift up the voices and what's happening in rural parts of our state. So we hope that this is just the first kind of event to kick off this partnership, and hopefully we can begin to talk a lot more about the issues impacting rural Florida. Now, there are a lot of different ways to assess Florida's healthcare landscape. We can look at health outcomes, affordability, and a number of other metrics, but we start here with access and coverage generally. Now, though we've come down from the huge spike in uninsured that we saw during the peak of COVID, Florida still has the fourth highest number of uninsured in the country. And obviously, we're way above the national average. Now, we know how important our Medicaid program is to covering low-income Floridians, but also how restrictive of a program it is. Now, despite the high thresholds to qualify for Medicaid, we've seen enrollment grow significantly since the start of the pandemic. Now, I think that just speaks to how deep of a need we have here in our state. It really reveals just how many people are living paycheck to paycheck and just on the edge of poverty. Now, the need we have for care in the state, I think it's also echoed by the way Floridians respond to the opportunity to sign up for coverage in the ACA marketplace. Florida continues to lead all of our enrollment efforts, and that's in large part thanks to our navigators around the state, but also there's just such a strong need for care that people, since the first open enrollment, Florida has continued to lead in the number of people enrolled. But an interesting little wrinkle as we head into the 2022 legislative session is the financial situation that we find ourselves in. Now, though the last few sessions we've come into it with budget shortfalls, and certainly we all feared the worst for 2020, a recent report from the state economist actually estimated that Florida has an additional $2.6 billion to spend in general revenue taxes, and that was raised during 2020 and the early part of this year. And that does not count the billions of unspent money that we have from the American Rescue Plan. So while Florida's still in an untenable position when it comes to coverage, I think this slide begins to show why that matters. Now, our partners at the Altarum Institute, they recently updated their scorecard that looks at healthcare affordability in Florida. What we've learned is that healthcare is unaffordable for most Floridians, whether you have coverage or not. Unfortunately, it's the uninsured who are less shielded from these costs. But on the whole, I think we're all left to combat excess pricing and unaffordable out-of-pocket costs. Now, I thought it might also be helpful to share some high-level talking points on healthcare in rural Florida. But I'll admit that that sounds a little silly talking to you all who are serving these folks directly. So you see a lot of this up front. But we know that COVID has taken a toll, a real toll in a lot of our rural communities. There was a report from Jacksonville University last year that found that the high COVID death rates in rural Florida were directly tied to poverty levels and the inability to access healthcare. I think one revealing metric when it comes to access in rural parts of the state is the availability of primary care physicians and dentists. Now, there were almost 3 times as many dentists available in urban areas than there are in rural parts of the state per 10,000 people. We also see that there are more than double the primary care providers per 10,000 people in urban parts of the state than rural parts. Now, additionally, the uninsured rate for low-income Floridians in rural areas is about 18.8%. That's nearly 6% higher than in metro areas. And in some counties like Columbia and Jackson, we find that the uninsured rates are even higher, in the 40 to 42% range. Now, finally, we've talked a lot in the public conversation about the stress that hospitals are under, and I think that that pain is felt especially in rural Florida. Now, of the seven rural hospital closures in Florida since 2005, 3 of them occurred in 2020 alone, and that includes Shands Stark Regional Medical Center, Shands Lakeshore Regional Medical Center, and Shands Live Oak Regional Medical Center. And one of the things I learned in our partnership with the Rural Health Partnership is actually how many people relied on those 3 entities specifically as their places for primary care. And so the impact once these places close, and even when they become emergency only facilities, the impact is very real for the people who relied on these places for their primary care. So it's in these conditions that we arrive at the 2022 legislative session. So just a quick look at some of the important dates during session. Like I said, it starts next month and it always lasts 60 days. Now it's starting a little bit earlier this year because it's an election year. But for anyone who's a regular in Tallahassee, you know just how difficult it was last year to really interact with session because the Capitol was mostly closed to visitors. But this year, so far, the Capitol is open and folks are allowed to sit in on committee hearings and meet with state legislators. So if it's something you're looking forward to getting back to, that opportunity is there this time. Now, the next 2 slides really are just to give you, really just so you have them available on the other side of the presentation. It gives you a quick look at who the leaders are and a general sense of how each chamber is made up. Now, if you're represented by any of these folks, I think it's also worth considering to reach out and build a relationship. Uh, I'll also mention that Senate President Pro Tem Aaron Bean, he's actually very active in healthcare and the Medicaid space. So if you're one of our partners who's really focused on impacting the healthcare conversation on the Senate side, at least, when it comes to top leadership, I think Aaron Bean is someone worth reaching out to and having that conversation with. Now, this slide, same as the last, is just a quick look at the Florida House. I think it's important to note that although these are the leaders now, legislators also pick their party leadership years in advance. So it's important to note that these leaders will change for the 2022 to 2024 cycle. Republicans have chosen Senator Kathleen Passidomo from Naples to lead in the Senate, and in the House, Republicans have chosen Representative Paul Renner from the Space Coast. Democrats have chosen Representative Ramon Alexander from Gadsden and Senator Thurston from Fort Lauderdale. So, just as you're reaching out and having conversations this year, if you're working on a bill that feels a little more long term, it's also worth reaching out and beginning to build relationships with these folks as well. But there are a few factors hanging over the regular legislative session in January. The first is the special session that was called in November. It was convened really for the purpose, the sole purpose of considering bills that restrict vaccine and mask mandates. The flagship bill, which is Senate Bill 2B, actually just restricts mandates from business owners, government, and school employees. It also gives parents grounds to sue schools. Uh, the other bills limit some information sharing, and it tries to give the state the sole ability to regulate working conditions. So Florida withdrew from OSHA. And finally, the last bill just removes the authority of the state health officer to order vaccinations for individuals. Now, this session already happened, and all of these bills passed. But it may have some impact on how regular session plays out. Now, also, technically, the only thing legislators have to do before the end of any legislative session is to pass a budget. Now, that's except for the second year after each decennial census, which happens to be in 2022. The legislature's redistricting committee has to redraw the congressional and state districts based on our population change by the end of this session. Now, our state grew by almost 3 million people from the last census, which means we'll now have 28 congressional districts. The committee also has to redraw lines for all 120 House seats and all 40 state Senate seats. Now, it's no surprise that redrawing lines is a super political process. Gerrymandering is definitely a thing, but it's important that the committee hears from Floridians. So I encourage you all to reach out to your legislators personally if this is an issue that you care about. The committee has released a couple of drafts of different maps, and you can find it at their website. But I'd encourage you all to get involved in that process and make your voice heard if it's something that you're interested in. Now, the other couple of things impacting legislative session this year is the potential end of the public health emergency, which has helped to keep Floridians covered during the pandemic. The Department of Children and Families is actually currently sending letters out letting people know that if they've been deemed ineligible, once the public health emergency ends, they'll be removed from Medicaid. Now, it's something we're monitoring, but has the potential to impact tens of thousands of Floridians. Uh, Second, like we've talked about, there's just the state has a lot more money to play with. So we'll see how, if at all, the state invests in Floridians. We have billions of dollars at stake. We have the opportunity to expand Medicaid, which actually saves the state even more money. So it'll be interesting to see how we justify for different things or different priorities that come out through session. Now, finally, there's what's happening at the federal level. The latest Build Back Better framework that was released actually includes a fair amount of healthcare priorities that would have some very real impact on Floridians and this upcoming legislative session. Now, I'll admit that the prospects of the passing of the Build Back Better Act took a big hit this weekend, but I think it's still worth taking a minute to highlight some of the proposed provisions at this point. Things are very likely to change, but this is hopefully close to what will ultimately pass. Now, the bill would close the state's coverage gap by giving more people access to marketplace subsidies. Uh, we've talked a lot about Medicaid expansion, and this provision would actually cover that population without expanding the Medicaid program. If folks would just have access to tax credits in the marketplace, that would make their premiums zero. Now, the Build Back Better Act also looks to strengthen coverage for children and mothers by making 12-month postpartum coverage the new standard. It also requires states to keep enrollees covered for at least a year, and it makes CHIP funding permanent. CHIP funding permanent, which we know for children's advocates out there know is a recurring fight every single year. Now, finally, the American Rescue Plan substantially increased the premium subsidies that were available to those with lower incomes, and the Build Back Better Act extends those provisions to 2025. But wait, there's more. Uh, the Build Back Better Act also provides funding for more uh, home and community-based services, which we know are critical for seniors and Floridians with disabilities. Uh, The bill encourages states to find better ways to improve service and increase access, specifically by improving reimbursements for providers. But it also encourages the state to come up with a comprehensive plan to really address what has been left behind. We'll talk a little bit more about it in the presentation, but Florida as a state doesn't do very well when it comes to providing services for Floridians with disabilities specifically. Uh, the Build Back Better framework also secures Medicaid funding for the territories, and finally adds a comprehensive adult dental benefit to the Medicaid program. So if it passes, we really do have a lot to look forward to, but it is a big if at this point. Now let's take a look at some of the bills that have been filed so far. Uh, Now, there have been a couple of bills that have been filed since we put this presentation together, so it's not an exhaustive list, but it's the couple that we're looking at for sure. And we'll start with Medicaid and coverage and access bills. Now, it's hard to talk about Medicaid without mentioning just how difficult it is for families and Floridians to qualify for coverage. Florida's Medicaid program is one of the most restrictive in the country. Now, while there are higher eligibility limits for mandatory populations like pregnant women and children, low income adults are left out. Using a family of three, for example, the most a parent can make in the state and qualify for Medicaid is $7,000 for the year. Now, if you're a childless adult in our state, there's no help for you at all, regardless of how little you earn. So if you're a childless adult in Florida who earns less than 100% of the poverty level, you have no options for care. Medicaid expansion, we know, is the biggest opportunity Florida has to expand access to care in communities across the state, and especially in rural ones. Uh, Now, we've had two bills filed so far. One is a traditional bill that would expand Florida Medicaid's eligibility limit up to cover people who make up to 138% of the federal poverty level. And then the other bill is actually a joint resolution that would put the question of Medicaid expansion on the 2022 general ballot and would result in a change to our Constitution that expands access to Medicaid. Now, there's still, the potential impact of the Build Back Better Act. You might be wondering, well, if it passes on the federal level, why do we need to keep working at it on the state level? And I'll say that if it passes in the Build Back Better Act, it definitely gives 500,000 Floridians who don't have any access to care, they would suddenly have the relief they've been waiting for years. But still, it's only a temporary solution that would end in 2025. Now, even if it passes, Florida would still have the opportunity to expand our own Medicaid program and claim the billions of dollars available and save the estimated $200 million a year. But moving on, Florida's had some challenges in children's coverage in recent years. We've seen a statistically significant increase in the number of uninsured kids. This bill, House Bill 135, looks to expand eligibility for the MediKids program, one of the different coverage programs that exist within Florida Kid Care. It also establishes the family contribution rates for this particular plan. Senate Bill 640, House Bill 419 is specific to another part of the Kid Care program. Title 21 is for families who are on the slightly higher end of the income scale. This bill increases eligibility, but also establishes contribution rates at different income levels. So I'll say for anyone who's working with children or advocating for children's access to care, input to legislators on these issues and how they impact the communities you serve, I think could be extremely helpful. So I'd encourage you all to get involved, not necessarily to advocate for any specific bill, but to help give legislators a perspective on how these things play out in the lives of the people who rely on them. Next, another topic high on our list of organizational priorities is oral health. One of the promising initiatives related to oral health is Senate Bill 184. This bill attempts to solve Florida's issues with oral health access by addressing the provider side of the equation. 5 million Floridians are living in areas with limited access to dental providers, and it's partly why Florida pays hundreds of millions of dollars in preventable hospital costs related to oral health. This bill would actually authorize dental therapists who are basically a mid-level provider here in our state. They would work under the supervision of a dentist, and they would have to complete additional years of schooling. They've been effectively used in 12 other states, and I think one of the benefits of going this route is that the industry typically it's marketed to and attracts folks from underserved communities, but typically the people who are also willing to stay in underserved communities and be a provider. So I think done the right way, done intentionally, it has the ability to reach a lot of communities who are facing a high number of disparities. Now, this is a bill that hasn't been filed yet, but it's one that we helped to get filed last year and one that we hope to continue working on again. It looks to strengthen another part of Florida's current Medicaid program or benefit structure, which is the adult dental benefits. Currently, adults enrolled in Florida Medicaid are only eligible to receive emergency dental services. And typically the services that alleviate any kind of immediate pain. And sometimes they'll do procedures to prepare a mouth for dentures, but won't cover dentures themselves. Beyond that, there's really no clarity about what non-emergency dental benefits are provided. The bill we've been pushing actually would expand the minimum benefit to include, some of those services that are necessary to prevent disease, but also treatment of emergency conditions, routine diagnostic and preventative care, basic dental services like fillings and extractions, and major dental services like root canals, crowns, and dentures. Uh, our hope and our thought, and there's research to back it up, is that the bill will ultimately reduce Florida's budget spending on costly emergency department visits for dental conditions that were preventable. Uh, According to Floridians for Dental Access, in 2019, Florida hospitals billed more than $630 million for preventable ER visits and hospital admissions stemming from preventable oral health issues, and Medicaid paid for nearly 40% of those visits. So just providing uh, coverage for the conditions that folks are seeing every day and really being preventative obviously helps to alleviate how much we're paying out when before these problems become more acute. Next, we'll look at bills impacting Floridians with disabilities. I'll say that as Florida Voices for Health, we've just begun doing more work in this space, and we're excited to begin lifting up and joining our partners in lifting up some of the issues impacting this community. A little background on where we are when it comes to Floridians with disabilities. As a state, we have a higher rate of people with a functional disability than the national average. We also know just how important home and community-based services are to helping Floridians with disabilities stay in their homes and live up to their full potentials. Unfortunately, Florida's waiver program has been underfunded for years, and in fact, funding has gone down most years since 2007. We currently rank 49th in funding for services for people with disabilities, and that leaves us with a program that has a waiting list that's about as big as the number of people that we currently serve. This bill, Senate Bill 1014, actually allows county health departments to request or to hire disability claims coordinators. Now, although there's no funding to support it, counties would at least be authorized to hire someone whose job it is would be to work with consumers in applying for different coverage programs and support services, helping them review their determinations and appealing claims where they need to. Uh, Now, obviously, counties might be less likely to pick this up without the funding to supplement it, but we think this authorization is a crucial first step, and we're excited to see how this. Before Floridians with disabilities, their families, and caregivers, the thing to watch during session will always be the budget process. The open question is whether or not funding will be cut for the iBudget waiver program or other support services. With the amount of money available to the legislature this year, it's an even more interesting question. Now, earlier this year, Florida Voices for Health, we hosted a series of roundtables featuring members of the community who are impacted by a wide range of disabilities. We got to see the incredible amount of nuance that exists in each individual story, but there were also themes that echoed throughout. Those were things like the need for reliable access to durable medical equipment, all the way to the need to simply have some conditions recognized. These bills reflect a lot of what we heard, so we'll be tracking them to see how we can support. For several of them, including Senate Bill 306 and Senate Bill 292, we have coalition partners who are leading specific campaigns to support those bills. So if you're interested in partnering with them or sharing your own work, I'm absolutely happy to make connections. Next, we'll go into an area that has increasing importance after the 2 years that we've all been living through. That's mental health and substance use disorders. First, a little bit of context as we consider a couple of these different mental health bills. Uh, Florida right now ranks eighth in the biggest changes in mental health since April last year. We've seen reports of anxiety and depression go up almost 13% since the start of the pandemic. It's a hard thing to comprehensively quantify, but you see other alarming statistics like a 65% increase in the number of calls to the Florida Behavioral Health Association. There's another recent report from Mental Health America that shows that there are millions of Floridians who are experiencing some form of mental illness, but that a high percentage of them don't have access to care. And in Florida, we ranked 49th in access to mental health care. Senate Bill 282 actually attempts to strengthen access to mental health services by addressing the provider side of the issue. It recognizes the impact of peer specialists, so people who have had similar life experiences, and tries to train more of them. Now, especially for those who have been caregivers for their friends and family, or people who have dealt with mental health issues on their own, uh, this bill would task the state with developing training and encouraging insurance plans, particularly Medicaid, to reimburse for the use of peer specialists. Next, we'll move on to what feels like the most expensive part of the healthcare system, and that's prescription drugs. A popular proposal that we've seen in legislatures across the country is capping the price of insulin across all health insurance plans. Now, this bill, Senate Bill 678, it's a bill that we've seen for the last 2 years. It would cap the cost of cost sharing obligations for enrollees at $100 a month. Now, we know from our story collection that it's a major problem for low income and middle income Floridians. We also know that even capping the price of insulin at $100 a month can still be a pretty high burden for consumers, but we see it as at least an important step in the right direction. Uh, I also wanted to quickly highlight findings from an earlier survey project from the Altarum Institute in 2019, where we found that 54% of the nearly 2,000 Floridians we spoke to were either worried or very worried about affording prescription drug costs in the future. And like I mentioned, we've seen this in other states, including Colorado and Illinois. There are a few other prescription drug bills that we're watching. That includes Senate Bill 564, which implements changes to prior authorization rules, specifically those related to stage 4 cancers. Senate Bill 742 looks to address costs by creating regulations and oversight of pharmacy benefit managers who, I won't go into it now, but we know that PBMs, pharmacy benefit managers, are typically the middlemen that make prescription drugs more expensive overall. This is a bill that was filed last year, but ultimately didn't pass. And finally, Senate Bill 1100 covers an issue that Florida Voices for Health has been advancing as members of the Florida Health Insurance Advisory Board for a few years. We know that health plans often change with which drugs they cover in the middle of the plan year. This bill will at least require that the plans give the insured and their providers reasonable and timely notice of those changes. Now, just to end on consumer access protections and health equity, so kind of a catch-all bill, section of bills of interest. Now, the first Senate Bill 998, the goal is to expand the use of new health information technology that is geared towards helping all of the providers taking care of a particular patient, really helping them to share information. The idea is that it helps patients get the best, most appropriate care without the delays and barriers that sometimes can come up in the sharing of patient information. This bill adds to the language of our patient bill of rights, really to raise the expectation that the information, personal information, will be shared among your treating physicians. And it also specifically instructs the Office of Rural Health and Rural Health Networks to be intentional about applying these systems across the patient care continuum, which is really just the whole list of providers that take care of a patient and provide a range of services over a period of time. Now, as we all, as a state and really as a country, as we go all in on telehealth in the wake of the pandemic, Senate Bill 726 looks to put some limits on on telehealth by prohibiting Medicaid from using providers who rely solely on telehealth to achieve network adequacy. So it's really to make sure that plans are giving consumers options that include both an in-person visit and a telehealth and opportunities for telehealth. It also prevents health insurance plans from denying payment for covered services provided through telehealth. And finally, it prevents HMOs specifically from requiring enrollees to receive certain services through telehealth. So makes insurance plans provide multiple options for getting the care that you need. Next, we know that equity and health equity is a growing conversation, especially in the wake of COVID. This bill looks to ensure that government is intentional about equity by creating an Office of Diversity, Equity, and Inclusion within the Office of the Governor. This office would be charged with creating a strategic plan that would enact policies aimed at establishing equity across state government, and would have a list of targets including removing systemic barriers and providing equal opportunity. And the strategic plan would be required to be reviewed every 4 years. Well, that was a lot, and in many ways, I've only begun to scratch the surface of what to expect during session. We know that so much of how healthcare plays out will be related to the budget process. So my hope is that when we host the debrief in a couple of weeks, that we'll be joined by our partners who can help us break some of that down and really understand how things have played out. But in the meantime, I hope that you'll all consider different ways to get involved and to partner with Florida Voices for Health. First, I'll say that you can get plugged in with Florida Voices by visiting us online at healthyfla.org or by sending me an email at scott@healthyfla.org. Uh, just being an official member of the coalition, we provide weekly updates on legislative session and other policy updates throughout the year. We also host a monthly call where we provide updates on timely issues. Now, like I mentioned, we seriously want to partner with rural-based organizations and individuals. A large part of our work is story collection, and we would love to partner with folks who are working directly in these communities who might have access, who might be able to connect us to folks willing to share their stories. So we have a full-time story banker, and we would love to make that connection. I'll also say that if you are just interested in keeping an eye on session, we have a legislative session tracker available which is just a live Google Doc that we update every week and lets you connect directly to the bills to see where they are in progress. Now, our largest campaign push is for Medicaid expansion. Florida Voices for Health, we're very fortunate to be a part of the Healthcare for Florida Coalition with some other great partners across the state. There are many ways to get involved directly. You can join the coalition at healthcareforfl.org/join. You'll be invited to join our biweekly coalition meetings and to just be a strategic thought partner with us. You can also encourage people to sign the petition or to share their healthcare stories at these links. Now, for those with an interest in oral health, we would love to bring you into that work as well. Florida Voices for Health and some of our in-state partners like Catalyst Miami were part of a state-based coalition called Open Florida. Open, which stands for the Oral Health Progress and Equity Network, is a national coalition initially launched by the DentaQuest Foundation years ago. The coalition grew and eventually formed as a standalone organization. The Open Florida Alignment Network, we're right now working to advance the adult dental benefit, but really we're mostly trying to build a coalition of oral health stakeholders who would be willing to work together to improve access to care here in our state. Now, if you're interested in joining the specific push to bring dental therapy to Florida, I would point you to our great partners at Floridians for Dental Access, who have been leading the charge for a few years. You can learn more at floridiansfordentalaccess.com. I want to thank you all for taking the time to hear out this presentation. We'll be sending out follow-up materials, including the slides and a link to this recording. But please don't hesitate to reach out if you'd like to learn more about any issue, if you'd like to share more about what you're doing. We really look forward to partnering with you all. Thank you and have a great afternoon.